Do not leave this podcast without going to the link in the show notes or description and clicking on the link to learn our centralization process. We will show you what you're missing in your sciatica recovery. And in this link, there will be a very important opportunity at the end for you to learn exactly what this plan could look like for you. Hello and welcome to episode 103 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is, what is decompression for your low back pain, disc herniation, sciatica? Should you do decompression? What is involved? What are the rates of success? What are the outcomes? What are the side effects? What are everything? Decompression for low back pain. Let's dive into it. Before we do so, if you have not joined our private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will be tagged in our free step-by-step sciatica guide that we take thousands of clients through around the world to show you exactly how to determine what exercises you should be doing for your sciatica, which ones you should not be doing, and how that plan can start to look for you. We literally take all of our clients through this and teach them how to resolve it. And we are providing this guide for free. So go join our private Facebook group, RehabFix Low Back Program, and you will immediately get tagged in this post, which is worth a lot of money for free. And you'll have access to a lot of other exclusive content as well. So go join. Now, decompression for back pain. This is a question we get all the time. Hey, I went to my chiropractor and I got on that DRX 9000. That's the most common one. We're doing decompression for my low back. Should I do that? Is that going to help? Everything in between. So here is the truth based on the evidence, and here is our opinion based on the multiple thousands of people that we have talked to, all of them having disc issues or sciatica issues. What we hear all the time is that most of the time it does feel quite good. Feels good. I would probably argue maybe 85, 90% of our clients who have tried decompression feel good doing it. Probably about 10 to 15% of it have had adverse effects. We've had some people where they did it and immediately they felt way worse and it flared up the situation for weeks or months thereafter. And it was not a good choice for them. But for the majority of people, they typically feel really good doing this. And that's not uncommon. Well, it's also not uncommon for this relief to be just during or in the immediate aftermath of that particular procedure. So it's going to feel good most of the time. It's also going to not last most of the time. And that's kind of just the truth. The concept of that is that if you have a disc herniation, you want to open up that disc space so the disc has room to squeeze back in. That's the concept. Oh, I just feel so compressed. I just feel like my low back just needs to be pulled apart. A lot of people feel that way. But you can't walk around all day with a decompression machine on your back pulling your spine apart, right? You got to leave that office eventually. What happens when you stand back up? Just comes right back together. Again, it's not a bad thing. Things recompressing is not a bad thing, right? But if the concept of that is, it's going to pull your disc apart, going to help the disc resorb. Well, if immediately when you're done with that, you just stand back up and go on with your day, you go back to sitting 8 hours, you go back to not exercising, you go back to not doing the appropriate rehab, not doing the things you should be doing, it's not going to do anything in the long run. It's not going to do anything. We've had tons of clients who have paid, like $3,000 or $4,000 for like a package, like a decompression, sequence, so to speak. Usually it's like 10 to 12 visits or something like that for $3,000 to $4,000. And you know what? I know that's not necessarily a lot of money when it comes to healthcare, and you might be willing to try everything. But we just don't see lasting effects from that. That's just not really something we see benefit a whole lot. So either way, if you're doing a passive therapy is something that someone else is doing to you. You are not doing it for yourself. Passive therapies must be reinforced by rehab. So massage, soft tissue work, tissue scraping, acupuncture, dry needling, e-stim, ultrasound, shockwave therapy, decompression. All of these things must be reinforced by rehab. They must be, because they don't do a whole lot on their own. They can do good on their own. Some of them are, much more evidence-based than others, but they must have active care as part of it. So even if you are doing decompression and it's worth that investment to you, and that's great, I hope it helps you, you still got to have a rehab plan after. Otherwise, it's not going to last most of the time. So very rarely will there be adverse side effects. We have heard some. It is rare to have adverse side effects, but it can happen. Sometimes people who notice adverse side effects will be the individuals where they find that rolling around in bed at night can be painful, or sleeping at night can be painful. Basically, when they're laying down and gravity is off of their spine, and the act of decompressing is increasing their pain. So pretty much anyone who feels more pain when they lay down or roll around in bed at night, if this feels painful to you, I would probably not do decompression, because it's the exact same mechanism. It's the same mechanism. And once again, a lot of people do feel good with decompression. A lot of people feel good during, might feel good 30 minutes after, but it's just that. You got to have something to reinforce it. So my recommendation would be is start with that thing that's going to reinforce it from the beginning. I haven't really found anyone who needs decompression. We haven't really had a single client who has come to us and was like, hey, decompression didn't help, but I know if I do it with your program, then it will. No, it's our program that gets them better, not the combination with the decompression. So we usually say, hey, there's no reason to do that. You can stop doing that. Let's focus on the right stuff. They do our program and they're better, because they're actually learning the active therapy that they need to do for themselves. You need to be in charge of your rehab. So let's kind of summarize this. The theory of decompression is that it's going to pull your discs apart. It's going to pull your vertebra apart so your disc has more space to suck that disc herniation in. Is there evidence to support that? Not really. Well, we don't need evidence to support every single thing we do. I'm not being one of those guys either, but there isn't really much evidence to support that. There is plenty of evidence that says it feels good to people, both anecdotally and in the available evidence that is currently out there. But we know a majority of the time it will be temporary relief because it's passive. That's the nature of passive therapies. If you're not learning how to be in control, it will be temporary. So that's the theory. That's how you're probably going to feel during and after. You're probably going to feel better, but is it going to last? Nah, not really. So I would say if you want to do some quick decompressive type things on your own at home, you can simply hang from a bar. You can lay on your back with your feet up on a table or a couch so your knees and hips are at a 90-degree angle, and you're letting that low back just relax into the floor, doing some deep belly breathing. You can also sit and push both arms into your seat and pick your body up in the air. That will provide a decompressive effect. Obviously not to the degree of one of those, $50,000 machines, but it still will do that. But then most importantly, reinforce that with some exercises. You can do some exercises from our page. We have plenty. We have a few thousand. Okay. If you're not exactly sure what exercise to do, then jump on a call with us and we'll show you. We'll kind of talk you through that process, show you based on your symptoms what you probably should or should not be doing. A link to do so is in the show notes of this. You can schedule a call with us, and we'll kind of take you through how your situation could benefit from maybe different exercises or different tools that might not be in your current routine. And then we can start to give you an idea of how that plan might look for you. So if you feel like whether you have or have not tried decompression, I would save your money and your time, to be honest. That's just the general consensus. Unless temporary results is worth it to you. That's fine. That's fine. But most of our clients are not after temporary results. Most of our clients are ready to invest in something serious and learn how they can get lasting results. So we would love to show you how to do that if you're in a situation where you're prepared to do so. If you're mentally ready to commit to a plan, if you're ready to be out of pain and you're serious about getting out of pain, then use the link in the show notes, schedule a call with us, submit an application on our website, join our private Facebook group, RehabFix Low Back Program, get involved, show you're serious. We're here to help. All you have to do is just be willing to accept it, right? A lot of people say they want to get better. Very few will actually do what it takes to do so. Very few will take action. Very few will put money where their mouth is. That's for sure. A lot of people talk about many different things in life. Oh, I want to make this much money. I want to achieve this physique. I want to be pain-free. I want to do this or do that. Okay, well, how many people are willing to put their money where their mouth is, right? Not that many. Those who do are those who actually achieve those things, are those who actually win. And I want you to win. So we're giving you every opportunity to win. You just got to be willing to commit to a plan and to take it serious. As long as you take it serious, we're going to take you serious, and we're going to make sure that you get to your goals, because we're here with you every step of the way to ensure that you get your life back and that you get to where you need to be, not where you want to be. You don't want to be pain-free. You need to be pain-free to live a normal life. You have one life. You have one body. You don't know when this life is going to end. You want your time on this earth to be pain-free, doing what you want to do. You deserve it. Your family deserves it. If you enjoyed this podcast, please leave a 5-star rating and review on your favorite podcast platform. If you're watching on YouTube, please like, comment, and subscribe. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.